Who do you hold close to your heart? If they were sick or need medical care, what would you expect from your community hospital? You would expect prompt emergency care in a welcoming, safe, and private space. And the best diagnosis and care plan for them, relying on the most advanced patient care equipment available. If your family welcomes a new loved one who needs extra care, you'd want a comfortable space where parents can stay close to their baby as they begin to bond together. You and your family deserve the best patient care our community can provide. Fortunately, Guelph General Hospital is one of Ontario's best hospitals, with high marks in safety, quality, and efficiency. And right now, you can help make our community hospital the best we can be for all the people we love. With your caring support, we will expand the emergency department to create more space, including dedicated private areas to support patients with mental health or addictions concerns. We will replace aging equipment with smart technology solutions to provide fast, accurate diagnosis and reduce administrative time spent by hospital staff. We will make sure that our tiniest patients in their first days of life and their families have the best start possible by reinventing our essential special care nursery. Guelph General Hospital needs your caring support more than ever to make these important changes happen. For you and for the people you love. A strong community makes a hospital greater, and a great hospital makes a community stronger.
Well, hello everyone, and welcome to this great event. Welcome to those joining me here at Strom's this afternoon, and those of you who are joining virtually as well. My name is Paul Osborne. I'm the chair of the foundation and very pleased to act as your MC for this special event. The video you just saw tells you a little bit about why we are here today. We're here to talk about Guelph General Hospital's most urgent community fundraising project ever, the $34 million Together We Care campaign. We have been working on this campaign for quite a while, and we planned on telling you about it in June. However, the pandemic changed our original timetable. As the pandemic ramped up, the hospital, the foundation, and the community focused elsewhere, as we needed to do. Once again, our hospital performed admirably under unprecedented circumstances. The need for support of our hospital is more important than ever. So even though we can't gather in person, we felt we couldn't wait any longer. We're glad that we can gather here virtually today. You'll be seeing a combination of live remarks and touching videos. For the live remarks, there are a handful of us here at Strom's Farm and Bakery. General Manager, Guelph General, and the campaign, and Strom's charity partner this year, and we're so pleased they have chosen us as their charity partner. We thought it would be a great spot to hold an outdoor launch. Channing, Amy, and the entire Strom's team, thank you so much for your support. For those of you who haven't been to Strom's yet, check out their website at strom.ca to book a visit this fall for family fun for everyone. My kids are a bit old these days, but when they were young, we certainly spent many a fall day here at Strom's. You know, at some point in our lives, we, or someone we love, will require the care and expertise of the first-rate Guelph General Hospital. Whether in moments of joy, pain, or worry, our hospital is always there when we need it. This next video shares one story of how Guelph General Hospital helped a family at a critical time in their lives.
My name is Liz Hewitt.
I'm Adam Hewitt.
And these are our 16-month-old twin girls. This is Jessica.
And Chloe.
So how the girls came to be born, the day before they were born on June 4th, I had very severe back pain. all day. My husband had gone to work, and around 5 o'clock, I said, this hasn't changed. Let's call labor and delivery and head over to the hospital. So we called them. They said, come on in, we'll monitor the babies and make sure that everything's okay. The doctor came in and told me that I had developed a pretty rare but serious symptom of HELP syndrome, which is a type of preeclampsia, and that it meant that enzymes were building up in my liver, and I was going to possibly go into multiple organ failure if I did not have the babies that day. And so all three of us were, there was a concern for all three of us. And so at that point, I got sent back up to labor and delivery, and that is the point where I called my husband to come back to the hospital with me.
And then within the hour, we had 2 little girls. They went straight into the NICU, into incubators because they were so little.
So after I was discharged, but the girls were still in the special care nursery, I was able to spend the nights in the
family unit.
Right. And it was right beside the NICU, which was fantastic location wise. But the only issue was that my husband was not allowed to join me.
No.
And so he wasn't even allowed to come in the room. I can only say from my personal experience that during postpartum, I felt so lonely and vulnerable. And on nights where I did sleep over at the hospital, I often cried when you left.
You're all by yourself.
Because I felt very alone in terms of the
care.
Right.
And the attention we got was phenomenal. But we were kind of stuck in a little corner, kind of curtained in, and having 2 babies in 2, I don't know what you call them, the incubators.
The little cribs.
Yeah, and to have anybody come and visit, it was really hard to fit. And being so close to all of the other people with their babies, it was really hard to be alone.
Thank you so much to all of the staff, the doctors, the nurses that really spent time.
Yeah, the care was phenomenal.
Liz spent time in our emergency department, our family birthing unit, and the girls were in the special care nursery. Vital pieces of equipment were used throughout their stay. Our campaign will support these areas and many more. And it's my privilege to introduce the 3 campaign co-chairs to tell you more about it. We are blessed to have these strong local leaders agreed to serve the community through their involvement in our campaign. It's my pleasure to introduce Linda Hasenfratz, Susan Frassen, and Rob Wessling. Linda.
Thanks so much, Paul. And thanks to all of you for tuning in. I'm Linda Hasenfratz. I am really pleased to be here this afternoon to launch this exciting campaign for our hospital. Linamar and our family, the Hasenfratz family, have always been very strong supporters of the hospital. In fact, we made a commitment collectively, the company and our family, of $5 million towards this campaign. You might ask why. Well, put simply, I think that every one of us uses the hospital during our lives, often at more than one point in our life. And if we want top quality, modern healthcare and equipment, we need to play a role in helping to provide that. You know, many people believe in Canada that our healthcare system is fully funded by our government, when in fact, the reality is that 100% or almost 100% of patient care equipment must be privately funded, which is why these kinds of campaigns are just so important. If we want top quality modern healthcare, it's up to us to step up and to support the hospital. Now that goes for big expensive items, things like MRI machines, but also smaller investments like pathology tracking systems or intensive care bed systems. It's equipment like this that really makes healthcare modern. It makes it efficient. It makes it accurate, and it makes it effective. And without it, we just really wouldn't have that level of healthcare that we all want for our families. The Guelph General, as you've heard, boasts some of the best performances of any hospital in Canada, and that's something we should be really, really proud of. It's ranked in the top 10 of the safest hospitals in our entire country, C to C. It has consistently been in the top 5 of shortest wait times in the ER in the province as well. So we're very lucky to have such a fantastic hospital in our community. The fact that we have such a well-run hospital was never more apparent, really, than this year during the pandemic. And we are all just so grateful to our hospital staff and their selfless commitment to keeping us all safe. You know, more than 300 babies are born each year in Guelph General Hospital. And just like Liz and Adam's girls, Chloe and Jessica, that you heard about, they are looking for exceptional care. But as you heard, the space is not really set up for that. So this campaign is going to enable us to reimagine our special care nursery to support the very best possible care and comfort for these most vulnerable newborns and their parents. We're going to increase the size. We're going to add natural light. We're going to increase privacy. We're going to have better infection control. In fact, we've already started purchasing new equipment to care for moms and babies, including infant warmers in each delivery room. And that's all thanks to all of our donors. So thank you all for contributing, and I hope you will continue your generosity going forward. With that, I'd like to invite Susan Frassen to come up and say a few words.
Thank you, Linda. And welcome to everyone who is viewing online. My name is Susan Frassen, and stories like Liz and Adam's happen every day at Guelph General Hospital. The incredible staff who looked after Liz during her time in the hospital used equipment that was funded by our donors. This campaign will ensure that we continue to have the best of equipment for our nurses and doctors and medical care providers to look after this community. Imagine for a moment that you've landed the best job in the world and you're living in the best community. Well, now imagine that your boss hands you a 20-year-old computer and a flip-top phone. Well, that's not going to work so well, and yet you're expected to do your job using that kind of technology. That's exactly what happens every day at Guelph General Hospital. We have doctors and nurses who are expected to save lives using some equipment that is actually 20 years old. As my father would say, that is not acceptable. And that's probably one of the reasons why my parents, Barb and John Wood, donated $2 million to this hospital campaign to ensure that our doctors and nurses and healthcare providers would have the best of equipment in order to save the lives of this community. To continue to provide this community with the best possible health care, Guelph General Hospital will need everyone's support. Our government dollars can only stretch so far, and in reality, almost all of patient care equipment must be provided by the local community. Through this campaign, we will purchase state-of-the-art equipment and technologies that will provide faster, better, and safer diagnosis, infection management, and treatment for our patients. We've already purchased $9 million worth of equipment in this campaign, and that was all funded by our donors. We have a new CT scanner, a mammography machine, a vital signs monitor that connects directly with patient records, infant warmers, new scopes, and specialized infection identification machine, and that's just the beginning. Your support will give Guelph General Hospital the ability to adopt new technologies more quickly than we'd ever believed. including advancements in infection prevention, management, and control. Together, we must care for our hospital so that our hospital can care for us. And Rob?
I knew that was going to happen. All right, there we go. So first off, thank you, Susan and Linda. It is really a distinct honor for me to have the opportunity to co-chair this event with two real forces of nature in our community and in the country. I'm learning fast, and I hope to continue to learn from these two powerful people. I'm Rob Westling. I've been a Guelphite for almost all of my life. A couple of intermissions, but for most of my life, I'm the Chief Executive Officer of the Cooperators Group of Companies. And we've had a history in Guelph, Ontario that spans the last 75 years. And our head office is here in Guelph as well. Aside from the opportunity to work with some amazing people on the campaign, why did I agree to take part as a co-chair? Well, there's the obvious reasons. Much of my family, we have many friends, 1,200 staff and advisors of the Cooperators all live and work in Guelph and the Guelph area. And so the hospital is an integral part of our ability to have good, sound, solid lives here. But there's a more fundamental reason as well. We believe at the Cooperators, I believe personally, that things like quality health care are a human right. And so the opportunity to participate in this campaign, both for the organization and for our family, is about ensuring that we can answer the call and have that human right delivered. As one of the fastest growing cities in our province, the community demands for our hospital services here in Guelph continue to grow. Our emergency department was built roughly 20 years ago. And at that point, we were averaging 45,000 visits per year into the emergency department. And that's increased significantly. So we average over 60,000 visits per year now in the same space. And so the hospitals recognize an expanded and growing need, not just for additional emergency capacity, but for additional capacity for mental illness and issues with substance abuse and addiction. As a result, one of the goals of the campaign is to increase the emergency department mental health and addiction support spaces. An increase of 50% is what is envisioned with this campaign. This will do things like reduce wait times. It will make those that are suffering with acute mental illness issues and others in the hospital community feel safer, more comfortable, more at ease because they have private spaces to be able to be triaged. This will result in fewer readmissions and improved dignity for patients and for their families and their loved ones. Ultimately, we want to ensure that the emergency department has the space and the resources to care for us, to care for all of us, to care for our families, to care for our colleagues at the times when we need it most. At the Cooperators, we strive to improve awareness of mental illness, to reduce stigma. We strive to make our own workplace a conduit for good mental health, a positive impact on mental health for our staff and for our communities. And it's for this reason that I'm very proud to announce that the Cooperators has committed $250,000 for the creation of the Cooperators Short Stay Assessment Unit. And so this unit, as an adjunct to the emergency department, will focus on the increase of capacity by 50%, as I mentioned, improving the safety and the dignity for patients and for their families, and to reduce wait time, access to care across the board. My wife Ray and I, we have a great deal of pride in the opportunity to be part of the hospital community and to be part of the foundation and this campaign. We do so both as volunteers and as donors. And our rationale is really quite simple. These actions, we believe, have a real impact in our community for our community, and that is clearly enough for us. So speaking of impact, let's take a look at this next video. The hospital's Chief Nursing Officer, Melissa Skinner, will share more on this topic.
Hi, my name is Melissa Skinner. I'm the Vice President of Clinical Services and Chief Nursing Executive here at Guelph General Hospital. I'm really excited to be taking part in this virtual event. There's a project that is near and dear to my heart that I can't wait to tell you more about, and that's the redevelopment and our campaign to help improve our emergency department. As many of you know, and we feel it every day, Guelph is growing. It's growing at a rate that's one of the highest in Canada. That rate of growth makes it really, really hard for our hospital to keep up and to provide the level of service that it really wants to be able to provide. In no area do we feel that more than our emergency department. Despite all of our challenges, we're still one of the best emergency departments in the province. Looking towards the future, this campaign and the wonderful community support are going to help us increase our emergency department by 60%. That means more treatment spaces and specialized care for our mental health and addiction population. It means fewer bays with curtains and more areas with walls. In the time of COVID, we're starting to understand how important those barriers are to keeping each other safe. As many of you know, communities like ours across Ontario have been struggling with an increase in patients seeking out supports and resources for mental health and addiction within emergency departments. This redevelopment is going to give us the opportunity to provide that care in a greater number of spaces, specifically designed for the specialized care they need. This is something that our community needs desperately, and I'm very excited to see how this campaign is going to help us reach that goal. The staff here are very excited. We're excited at the thought of great space, amazing new technologies, all of this coming together to help us provide the best experience. Thank you very much. It has been a pleasure spending these virtual moments with
Thank you very much, Melissa. These projects will make such a difference at our hospital. Rob, Susan, and Linda are exceptional co-chairs leading an exceptional team of campaign volunteers. For a full list of our committed campaign cabinet and volunteers, please visit togetherwecare.ca. Members of the foundation and the hospital boards are also providing leadership. We are very proud to say that in addition to their gift of time and talent, each of these volunteers has made a financial gift together, and we have contributed $8.7 million to the total amount that we have raised. So congratulations to all those involved. At this time, I would like to invite Rob, Linda, and Susan to join me at the podium. And now we are very excited to tell you that thanks to the generosity of so many in our community, we have already raised $27.6 million. We have the beautiful chart just to my right there. Congratulations. I think I can hear clapping at home. I'm not sure, but I wish I could see the smiles on your faces. Thanks, Rob, Susan, and Linda, for all that you have done, and to all of Guelph and Wellington who have supported us to date. We live in an amazing community. And it's now my great pleasure to introduce Mayor Cam Guthrie, who is also an important member of our campaign cabinet. Mayor Guthrie.
Well, thank you so very much. Many of you have probably heard me say often that hospitals are funded by the province. And so you're wondering, why is the mayor here right now? Well, the issue is that from an operational standpoint, that is absolutely true. But when it comes to the equipment, as we've heard from our speakers before myself, when it comes to any kind of expansion or renovations, it is on the community to pull together, especially 100% for equipment and 10% when it comes to renovations or expansions. I am so thankful that with the request from the hospital to City Council last year, City Council did make a commitment of $4.5 million towards the campaign. And so on behalf of Council and the City, thank you so much, actually all of you, for with your tax dollars, yes, going towards the much needed expansion, renovation, and equipment at our hospital. Now, many donors you've heard of already so far, and they need to be thanked big time. Of course, there is also, from a video that might pop up here on the screen, there's a kind of a pumpkin patch with some notes attached to it, as you can see here, of many, many, many donors. And maybe you're watching this at home thinking, boy, I would love my name to be put on one of these pumpkins. Well, I'm glad you asked, because there are many, many ways that you can donate. Of course, you can go online and have a form there that you can fill out. You could maybe reach out if you want to talk to something a little bit further than just an online donation. You can talk to the foundation team. My wife Rachel and I did that. We found out a way that we could give, and they're just so helpful to figure out what is the best way of giving money towards this campaign that can reflect what you want to give and have it go exactly where you need it to go. Thank you to events like here on Stroms. Maybe you and your business, maybe you want to figure out an event that can bring awareness to this much needed campaign. The point is that whatever you do, and honestly, if it's $1 or $5 a month or a lot more, it can go to helping our community and our hospital. It is one of the best. We need to keep it the best, and your donations help with that. Maybe there's a birthday coming up. Maybe there's Christmas or the holidays coming up, and you can say, you know what, instead of gifts, I want everyone to, instead of giving gifts to me, I want the money to go to the hospital. Maybe you never might use transit in town, or maybe a rec center, or a library, or whatever other services, but I can guarantee you that you will at some point yourself or your close family members will be using our hospital. And so let's all rally together and get these donations in so we can meet that goal.
My name is Carter and I'm 9 years old. Hi, my name is Sienna and I'm 7 years old.
Well, hello, Carter and Sienna. You guys did something really, really nice for the hospital recently. Tell us about that.
So me and my sister did this little business where we made bracelets, anklets, and necklaces, and I have one on me, by the way. And thank you for my friends and family who bought off of us, and we raised $200 for the Guelph General Hospital.
That is amazing. Tell me why you chose to support the hospital with this.
We chose to do this because we were helping the frontline workers, and we raised $200 for masks to keep you guys safe and the people in the hospital safe.
Aw, thank you. How did that make you feel to do that?
It made me feel happy because I got to help out all the sick patients in the hospital. It made me feel happy from my heart that we did it by ourselves and we helped you guys out.
Well, we are so happy that you helped us out too. We really can't do what we do at the hospital without our community, and you're really an inspiration that everyone can help out. And so we are so thankful, and I'm thankful for my bracelet, which I have on today. So thank you so much, Carter and Sienna. You guys are great, and we're really happy to have been with you.
Hello, everyone. My name is Marianne Walker, and I'm the president and CEO of Guelph General Hospital. I want to thank you, Carter and Sienna, for supporting our patients. The bracelets are beautiful, and I really hope one day you think about a career at Guelph General Hospital. So Cam, thank you. As always, you've been such a strong supporter of the hospital. We couldn't do it without you and our community. So much has changed since March. We all wear masks. We ask lots of questions when you come to the hospital. But I'll tell you, one thing that has not changed is the caring staff and our physicians and the importance of our campaign priorities. In fact, these are more urgent as we reflect on this year and how essential it has had to have such a well-equipped local hospital, with ample space to accommodate the growing and at times unplanned needs of our community. Guelph General Hospital is one of Ontario's best and safest hospitals, and together we can keep it that way. On behalf of everyone at Guelph General Hospital, thank you. We are so grateful to our donors, and you are truly part of our healthcare team.
Thanks, Marianne. My name is Suzanne Bone. I'm the CEO of the Foundation of Guelph General Hospital, and it's really my privilege to work with our dedicated cabinet members, our board members, our amazing donors, not to mention our amazing staff team. Our foundation board started talking about a campaign 6 years ago, and so many have been working so hard through all the stages to get us to where we are today. 34 million seemed like a really ambitious goal, but there were such important projects to make possible. And my goodness, we are blessed within a generous community. 80% of the way there. Just $6.4 million to go to fund the important priorities you've heard about this afternoon. We hope all of you will consider joining us and making a contribution of whatever amount you can. You can go to togetherwecare.ca for more information, to learn more about how you can make a difference, how you can help us save lives and improve health. Thank you. I'll turn it back over to Paul.
Thank you, Suzanne. It's been a great day and a great kickoff for our campaign. We've got sunshine. We're at Strom's Farm having a beautiful experience, and we're so glad you could join us as well. A strong community makes a hospital greater, and a great hospital makes a community stronger. Thanks again for joining us. Follow us on social media. Check out our website for more information. And it's www.togetherwecare, all one word, togetherwecare.ca. Thanks for joining us, and we look forward to your support moving forward.
Relying on the most advanced patient care equipment available. If your family welcomes a new loved one who needs extra care, you'd want a comfortable space where parents can stay close to their baby as they begin to bond together. You and your family deserve the best patient care our community can provide. Fortunately, Guelph General Hospital is one of Ontario's best hospitals, with high marks in safety, quality, and efficiency. And right now, you can help make our community hospital the best we can be for all the people we love. With your caring support, we will expand the emergency department to create more space, including dedicated private areas to support patients with mental health or addictions concerns. We will replace aging equipment with smart technology solutions to provide fast, accurate diagnosis and reduce administrative time spent by hospital staff. We will make sure that our tiniest patients in their first days of life and their families have the best start possible by reinventing our essential special care nursery. Guelph General Hospital needs your caring support more than ever to make these important changes happen. For you and for the people you love. A strong community makes a hospital greater, and a great hospital makes a community stronger.